The first part is actually a caregiver does that brings the person to a mental health facility for treatment. But it goes beyond that. It is also ensures that the person takes the medications and looks after the person, the side effects which come out, and be able to consult their doctors for that. Right from when the time the person wakes up to nudging him to have his meals, have his medications, engage in some activity, encouraging them to go out, just out to socialize is itself is difficult. Encouraging them to work is even a bigger challenge. So to summarize, I would say that looking after them during the whole day, I think every moment is a challenge for the caregiver. So initially, I don't think it's an issue because they are very willing to help, and they think it is their duty, and they do it quite, in a very positive spirit and energy. But after some time, they realize that it is an unending caregiving, and it goes on and on and on. And then the illness also has some fluctuations. Suddenly the person is very withdrawn or very aggressive or very demanding or very stubborn and not listening. So these bring about the first feelings of frustration in the person who's providing the caregiving. Once it continues like this for a few weeks or months and without any additional help, then the person starts feeling fatigued, tired, burnt out, or even depressed. It starts affecting their lives, their own lives, because they stop meeting other friends and families. They stop going out for social occasions because everybody will ask about the person having mental health problem. They can't talk about it openly like one would do for if a person had, let's say, heart attack or hypertension or diabetes, which people like to talk about. Then it affects their work. So once it affects the work, it affects the finances which come in. It can also cause health problems to the caregivers. So leads on to what we call as a caregiver burnout. In a burnout, they become totally depersonalized. The person with the mental health problem looks like an object. So that is when I think they have lost track of the passion that they had or the energy that they have to look after. The difficult questions which the person with mental health problem keeps asking is a big challenge. Why should I continue to take medicine? Now I am feeling well. So it's not like typhoid that the fever is down and then you finish your course of antibiotics. So giving medications to a person is a very big challenge. Not only all the medications are expensive, they need to be given for many years. That is one factor. Some of the medicines also require other investigations to see whether the levels are adequate, whether it's causing any side effects. So all those investigations are also very expensive. The person has to keep away from earning job. Not everybody lives very close to the hospital. So traveling, and even if they have to come once in a month, once in a fortnight, once in 3 months, it's a very expensive thing. When we are talking about severe mental illness, that is something which people like to hide for a number of reasons. Not only because of the hereditary genetic nature, but also people are perceived to be dangerous to the society or harmful to the society, or they might have a negative effect on the family members of the people in the neighborhood. So people still think that they are very unpredictable. Stigma in the society is one issue, and internalized stigma is another issue, where a person feels that, well, I am the stigma felt by the person himself. The caregiver can also feel a stigma. They might think that I am coming out, see people are closing the door, they are going in, they are avoiding to talk to me, or they are avoiding to have any relationship with us. It might have nothing to do with the illness, but the whole perception changes. One thing is openness and to talk about it. In openness, I think repeatedly when they do, even people in the society would be able to empathize with them. They would be able to appreciate that these problems are there. So one way is when they talk about it and then reassure people that it doesn't mean dangerousness or aggression or violence every time, or that this is not what is going to affect the other family members. That is one way of reducing stigma. The other is calling them up about their role and duties as a responsible member of the society. They should be able to help people like they help people with other disabilities. Stigma arises out of ignorance. So that is why I think knowing about it, and then maybe even leaving them with the person for some time, then they feel that actually there's nothing wrong. And it would be another way of educating by example, that you are able to do it. And also it would be reassuring for the gatherings to see that actually this person can be very helpful, and it's whatever apprehensions they had, they need not come out true every time.